Good morning. My name is Mark Silver. I'm continuing in the series of videos specifically for parents who have children with borderline personality disorder. I've previously written a book, Borderline Personality Disorder from Chaos to Authenticity, another shameless plug. Um, Today, we're going to be talking about something which is really very difficult. Many of these subjects are very difficult for parents. Um, we love and we idealize our children and we want them to be healthy and happy. Um, and yet, um, even though we see our children as innocent and growing, and there's a great deal of wonder as they explore the world and explore themselves, family, environment, and so on, um, we always believe that our children are not only on the right path with regard to their general decision making and judgment, but that their thinking, although it needs to develop throughout childhood and adolescence, is healthy. And what I'd like to talk about today for a few minutes is the child who suffers from psychosis, the borderline child who has psychotic ideation. Um, it's a terrible reality for parents. And the first thing I'd like to do is just explain a little bit about psychosis. Psychosis has three major elements. It was formerly thought that it had two. The first major element are hallucinations. Our hallucinations are basically perceptual disturbances or false perceptions with regard to sight or hearing or taste or smell or touch. Um, by far, almost all hallucinations that occur with individuals are either audio or visual, and even then, most are audio hallucinations, and then visual hallucinations are secondary. The second kind of psychosis after psychotic ideation after hallucinations are delusions. While hallucinations are false perceptions, delusions are false beliefs. And the main difference is that while you can have a hallucination, it can only be one of the five senses because there are only five senses. They tend to be grouped into a very small number of categories. Um, Delusions are very different. You can be delusional about almost anything. And in fact, there are a host of different words, terminology to describe different kinds of delusions, different kinds of false beliefs. Almost all false beliefs, especially for those individuals with serious psychiatric disorders such as schizophrenia, involve paranoid ideation, where the person believes that other people want to harm them. The individual may hold grudges, feel quite guarded, suspicious of others, and so on. But there are many other kinds of delusions with regard to self, where the person may not um, have an understanding of their identity in a psychotic way. They think their identity has been stolen. They think their identity has been switched. They think somehow that their identity is intimately connected with death. For example, they believe they are dead or that they were never born. All kinds of really weird ideas that are out of touch with reality. And that's the definition of psychosis, out of touch with reality. So you have hallucinations and you have delusions. There's a couple of other areas which I want to talk about, and one of them is thinking. You can have psychotic ideation in the sense that your thinking is blocked. It's not mature. It's unable to fully process a thought, or your thinking becomes halted, or it can be very disordered. There's another area of psychosis which is very important, particularly for understanding schizophrenia, which is more cognitive oriented, and it's related to what I just said, but also people who tend to be uh, to exhibit what's called negative symptoms. They're much more isolated. They have flat affect and so on. Um, when we think about children, we think again about children who are lively and giggly and exploring the world and making friends and sometimes getting hurt, but recovering and, trying out this kind of instrument or this kind of art or this kind of sport and doing well and sometimes not doing well, but recovering. But their general thinking slowly matures. In some sense, children are more dangerous, healthy children, as adolescents because they become more free. Their judgment is developing, but they have the opportunity to be more free. And as their judgment develops within the world outside of the home, they can experiment with sex and drugs and all sorts of things. And yet their thought processes continue to develop. And parents with borderline children who show psychotic ideation, where they may actually have hallucinations, but often have paranoid ideation, some of it may be transient, or other kinds of problems in terms of their thinking, which may also be quite cognitive oriented, as I put in my book as a crucial criteria not found in the DSM-5. It can be quite difficult to see your child, throughout adolescence and then young adulthood, and maybe even beyond, clearly have these kinds of crazy thoughts involving, false senses or false beliefs and so on. And it's important that they're confronted so that there's reality testing for the child. It's also important that the child understands what is real and what is not real. At the same time, there has to be reality testing between and among family members. The parents themselves may feel like they're going crazy because of how the borderline child presents with their thinking, with their emotions and their behaviors. And there has to be reality testing among the healthy people in the family. Just like, and I don't want to overdo this parallel, but like on a psychiatric unit, you have people who are not well and they present with mental health challenges. And the staff, the social workers, nurses, psychiatrists, and so on, psychologists, they reality test among themselves. They discuss the individuals to understand and confirm with one another how the person who is not well presents their ideas so that they can be confronted in a healthy way, but also so that the staff members among themselves are able to confirm for one another, oh yeah, that idea that person just said, that just doesn't sound right. Similarly, when parents have a child who's not presenting sound ideas, you want to do something very similar. The parents should be able to discuss with one another and say to one another, yeah, what she just said, our daughter, that just doesn't make sense. It seems to be coming from a good place, maybe even from her heart, but it just doesn't make sense. She seems to be saying things that suggest that she's quite, perhaps paranoid, perhaps very guarded, suspicious, and this can come out in different contexts. For borderline adolescents, one of the major contexts that this occurs is in normal everyday socialization. So the child will be in a school program, for example, and the child will come home complaining quite regularly about his or her peers or classmates, saying that, the peers or classmates aren't nice to him, or that they're picking on him, or that they're saying things behind his back, or that they're being derogatory when he puts up his hand in class to say something, or that they're very vigilant about what he gets on tests and how he does in school because they're jealous. And these are all indicators of pathology, of something that's clearly not right in the thinking of the borderline child. This is a very serious matter. It needs to be noted with the child's mental health providers and of course the pediatrician. One of the most serious issues is that there are acute stressors that occur in everybody's life, with people who are particularly fragile and vulnerable, such as borderlines, these stressors seem not only to ignite a period of anxiety or maybe depression, isolation, and so on, but it tends to also um, either kick off or exacerbate already existing psychotic ideas. Um, Sometimes these stress-related induced psychotic episodes can be quite short-lived, as, for example, when the borderline child feels that in school a classmate has done something to make him feel insecure in the school program. Hopefully within a day or two, it it simmers down and the borderline child feels sufficiently secure enough again to attend school, attend class, and talk to other students and so on. When the borderline child, however, feels that it's a systemic issue, then it can be much more debilitating for the child. Um, and indeed, one of the differences between hallucinations and delusions is that hallucinations tend to be more linear. I'm not sure if that's a good explanation. For example, if I tell you I hear my grandfather, who's been dead for many years, talking to me, that's a hallucination. But it's direct. It's him talking to me, and I am listening to him. With borderlines and delusions in general, they tend to be more systemic in nature, which means that the false belief, again, let's take the example of paranoia, the false belief tends to be more systemic, so that if the borderline child comes to you and says, I'm not doing well in school, and you start inquiring, and it becomes clear that the child tells you that it concerns how other students are approaching him in class and how he's being picked on or bullied and so on. And some of that, may be based in a grain of truth and may be based quite concretely in truth. It's systemic in nature. In other words, the borderline child is telling you about a broader way of thinking that that individual has that is not linear but systemic, and it holistically affects that individual and very much impinges on their socialization in school, how they participate in the classroom setting. It impinges on their willingness to focus on homework assignments, and it can have all sorts of problems. For example, extracurricular. If you're quite paranoid in that way, you may not want to involve yourself in extracurricular activities, including arts or music or sports within the school program, or maybe even outside of the school program. The subjective experience of the borderline must always be accounted for, even when there is psychosis involved, because ultimately it's the borderline's internal world and how they understand the world cognitively and so on, emotionally, and how they behave in the world, which will indicate how they function on a daily basis. And so it's important that even when the person sounds crazy, you deal with their crazy ideas. And this is no less true with someone who has a full-blown psychotic issue, such as individuals with schizophrenia. When someone says that they hear their dead grandfather, you don't ignore them. You join with them. You want to understand what the grandfather is saying to that individual. You want to understand, what kind of relationship did you have with your grandfather? Was it positive? Do you have good memories as a young child with your grandfather? What is the quality of the information being provided by the grandfather? Do you talk back to your grandfather? Is this a very positive and loving conversation you have? Are the things that he says very supportive? Perhaps you're feeling isolated or alone in your life, and your grandfather's providing you a kind of support that you may not otherwise have by people who are around you. The borderline subjective understanding of himself and others is just as important as objective reality, because the borderline primarily understands the world through his own perceptions. While the borderline is often blind to his own unconscious hostility, that is, the anger that he has towards himself and others, he is often paranoid and hypersensitive to the hostility of others, often provoking reactions, including dissociative symptoms. And I want to talk about this for a moment. Borderlines with dissociation experience a cognitive breakdown or a lack of cognitive continuity, which involves disruptions in thoughts, memory, awareness, or surroundings, the individual's surroundings, their immediate environment, a breakdown of their identity, and so on. It would seem that some people voluntarily use dissociation as a defense mechanism to stave off anxiety. Everybody has heard of fight and flight reactions, and the idea is that these were the two options that were considered in earlier times in our development as a species when there was acute danger in the environment. There are two other issues related to flight and fight that are not often discussed, and they're called fawning and freezing. Fawning, and I use this example because, I've hiked a few times and I saw bears in the wood. And when I see a bear in the woods, I don't flight, I don't run away because I know the bear can catch me and kill me. And I don't fight because that would be obviously dumb, because the bear would overpower me. So there's two other issues in regard to this, and that's fawning and freezing. Fawning means that you are trying to placate the threat by working with the threat's behavior or mimicking or trying to in some way calm the threat to placate it so that it is less dangerous, less threatening towards you. The second thing is freezing. That is, and again with the bear, rather than fight or flight, you just don't move. You allow the bear to walk away if possible, or to become redirected because it's eating or doing something. You freeze. Fawning and freezing are very well known defense mechanisms in cases of abuse, particularly physical and sexual abuse, but also emotional and verbal abuse, where the victim cannot flight, they can't run out of the home for one reason or another. They can't fight because they feel psychologically or just physically overpowered. And the individual will fawn, they will somehow try to placate the abuser so that the abuse is less severe, or to perhaps even try to ensure that it does not occur at all. And the freezing occurs where the abuse victim feels that by freezing, allowing the abuser to do whatever the abuser wants will perhaps minimize the harm that the victim will suffer. While fawning is about tactical engagement, freezing is about tactical disengagement. Dissociation is an important issue here because it relates to psychosis and suggests that there are times when the borderline will become less aware of their surroundings and identities in such a way that if it occurs on a consistent basis, they seem almost always out of touch with reality, in the sense that they're out of touch with not only their identity, but they're out of touch with their needs. They're not functioning quite well. These are individuals who are at risk of not getting what they need done in terms of an adolescent's or young adult's responsibilities with regards to school, socialization, home, family, and so on. So this is an important area for parents to be aware of. They need to reality check just as they need to reality check with their child. They need to be a strong wall of understanding particularly for a child with these kinds of symptoms, because the child's friends and peers are not going to reality check for that individual. And lastly, this needs to be clearly explained to the healthcare providers, pediatrician, and so on, so that those individuals are given the tools they need to understand the borderline child. And I say that because, and we'll discuss this in a subsequent video, the pediatrician, the psychiatrist, social worker, whoever, they're rarely in the home. And when you go to a doctor's office or professional's office, you act differently than you do in the home. You say things that are different than what you say in the home. You have different thoughts than you do in the home or community or even school. And so the reality testing is not only for yourselves, it's not only for the child, it's also for clarification for the healthcare professionals.